I am so thrilled to welcome Gretta Ellis. Gretta Ellis is a holistic nurse. She's a nurse practitioner. She was in emergency medicine for 10 years. She's going to give you her testimony. She is my personal healthcare provider. I personally prefer nurse practitioners, but I could be a little biased since my husband also is a nurse practitioner. And I sleep with him, so I have to follow the rules carefully, right? How many of you know I do not follow rules? Those who know me go, yeah, that's just not true. So I'm thrilled to have her here. By the way, bioidenticals, she does my bioidenticals, and she's going to talk to you a little bit about how that's affected. And let's all give her a warm welcome.
Again, my name is Gretta Ellis. I'm a nurse practitioner with Healthcare Partners here in the Villages. Our office is located near the Villages Hospital, kind of across the street in the Medical Plaza area. I specialize in bioidentical hormone replacement and among other things as well. A little bit about my background, how I got into
Although louder,
Is it louder?
they're having a little trouble back here.
I can make it louder over there.
Okay, great.
Better?
Yes, much better. Thank you.
If there's a problem, just let me know. I can always move it maybe a little closer. I just don't want to have that annoying breath sound. But a little bit about how I got into this medicine practice is my first 10 years, I went straight to school. I graduated at 21. I went into the medical field. And I was a registered nurse actually here in the Villages Hospital. I know in the emergency room, don't blame me for that mess, but I really tried hard to, do a really good job. But I also worked in Leesburg ER. So I have a strong background in what it takes to recognize a emergency situation and how to treat it. But there was a point in my life I started going to nurse practitioner school. I started getting really sick. So I ended up having a course of antibiotics, a couple different courses for my daughter, bringing home different food bugs, stress. I was getting married and doing full-time school. I ended up getting a lot of digestive issues. So I ended up I was about 95 pounds. I couldn't eat anything without having a really hard time digesting. And I just had pain all over, constant migraines, back pain, brain fog. The brain fog was the worst because I couldn't even take care of my family at that point and try to do school. So I went to regular doctors and I didn't get anywhere with regular doctors. They just wanted me to take a pill, take a Band-Aid, and deal with it and feel better. And I'm like, well, no, I don't want to do that because if I get on these pills at this age, I'm only like 28 years old. I'll have cancer by the time I'm 40 because if they kill your immune system. So I went the holistic route. I changed my diet. I did a lot of gut healing supplements. Your gut is where it all lies for digestion, healing and sealing the gut. So then I changed over to holistic medicine. That's how I got here. And now I weigh 140 pounds and my health is amazing. And then I started diving into the hormone factor because my grandparents got Alzheimer's disease. And I'm like, well, if I can heal myself from what I went through, why can't I help people with Alzheimer's and prevent this from happening to other people? So I'm constantly digging into medicine and listening to blogs and trying to further my education. So this is a little bit about the how does hormones affect Alzheimer's. A lot of the information, I've been studying the book, Dr. Bredesen's Infants Alzheimer's. Much of the information from today's presentation I have based on my own clinical knowledge and experience, as well as the book for the End of Alzheimer's from Del E. Bredesen. This book is a great resource. If you're not good at reading books, You can download Audible, and it's a great resource to listen to the book and get the information without actually having to sit down and just read it. If you're driving different places, this is how I read this whole entire book in a short period of time. Despite billions and billions of dollars, the government agencies and pharmaceutical companies and technological wizards have tried to invent and test drugs for Alzheimer's. Most of them, 99.6% of them, have come up with, these terrible failures. They're just band-aid medicines, and a lot of them don't work. They just cover up some symptoms for a short time, and they're not effective. The patient continues to get worse and worse. So there has to be a way to stop this from progressing. So Alzheimer's disease robs its victims of their humanity. It terrorizes the families. I've had a recent experience with my husband's grandparents, and we took care of them. And the onset of 2 different types of Alzheimer's, Lewy bodies dementia and Alzheimer's dementia, it took both of their lives. Unfortunately, it was almost too late for them. By the time I got my knowledge, they were already too far gone. And like I said, our puppy passed away earlier this year, and our grandma died on Thanksgiving. So it's just a terrible disease. She didn't know who we were anymore. She couldn't take care of herself, live on her own. So I'm just telling you that this is very important to me for your loved ones and to prevent this from happening to you. And it is reversible. I've seen it happen. I'm treating some patients in the office now that had early onset that we are able to reverse a lot of their dementia symptoms. So basically, I try to start out with know the signs of early detection. It matters because the earlier you get a hold of the disease process, the easier it is to reverse. Memory loss disrupts your daily life, challenges in planning or solving problems, difficulty completing familiar tasks at home and at work or at leisure, confusion with time or place, trouble understanding visual images in relationships, new problems with speaking and writing. Just pay attention to all your loved ones for any of these symptoms at the onset. A lot of times I've seen patients, they withdraw from their social activities because they don't want their friends to know that this is going on. Changes in mood and personality. And a lot of times you will see the person refer to, hey, why don't you ask that question or answer that question for me? What do you think, Bob? Answer that question for me. So that's a lot of things to look out for. Why does Alzheimer's occur? A big thing is inflammation. I'm a big proponent on diet, and an imbalanced gut is a key factor. Decline in shortage of supportive nutrients. You have to have a well-balanced diet. Lack of hormones supporting the brain molecules. Toxic exposure such as heavy metals, molds, and pesticides over a lifetime. This all adds up. That's okay. Can everybody hear me okay? So I'm here today to teach you how the bioidentical hormone replacement can prevent and repair the cognitive decline. And like I said, it's for both men and women. The word hormone comes from the Greek meaning to impel or set into motion. Comes from Dr. Bredesen's book. Many hormones contribute crucially to optimal cognitive function. They do this by signaling molecules that are produced traveling in different areas in the body. They particularly support nerve synapse formation. So in the brain, those hormones are needed to continue to have that brain and memory cognition, and maintenance of the brain. When your hormones drop and you're postmenopausal, your cognition declines. I don't know if any of you have noticed that, but it's a real thing. You start being forgetful and things start going down from there. Another thing I didn't put in my slide that I meant to put in there, there's a thing that we test for a genetic way to determine if you're exposed to getting Alzheimer's at a higher rate. It's the APO4 genetic genes. Has anybody ever heard of that? APO4, has anybody ever tested for the APO4? Who has APO4s? You have an APO4? Linda has an APO4? So, you have double? So, I test for that in my office as well, if you have that genetic susceptibility. But it doesn't mean that you're automatically doomed. 90% of those people do end up getting Alzheimer's dementia, but there's a 10% that don't get it. And the way to prevent that is cracking down on making sure you have hormone replacement, diet is key, and physical activity. There is a way around it. So everybody's like, well, I'm too scared. I don't want to get tested for that because if I find out I have that, I'm going to just have anxiety. Well, there's a way that you can prevent and be in that 10%. It takes a lot of effort on your part, but it is possible to have a way around that. Bioidentical hormone replacement, the goal is to replace and restore natural hormones that decrease as we age. It improves the person's well-being as well as quality of life, promotes a longer, healthier lifespan, in the essence of preventative restorative medicine. One of my main things when I am at work, it's more about quality of life than quantity of days. It's very important. As long as you can live and you can know your friends, have social activity, be able to take care of yourself and drive around, that's more important than quantity of days, I feel like. Benefits for men and women. For men, it increases energy levels, muscle mass, exercise endurance, sexual drive. It does help. Memory concentration, improves sleep, hair growth, joint aches and pains, improves strength. Cholesterol even improves because your inflammation goes down. Protects against heart disease. So when I started into this, my father-in-law, he's about 62 years old, and he was a little skeptical, but I said, just come try it. What's it gonna hurt? It's not gonna hurt you to come try it. So he came, did everything, we had to do some hormone testing, and he came and did it, and he's like, wow, he's like, this is probably the best thing I've ever done for my life. I can get up out of bed in the morning. I don't feel like I wanna just sleep in bed all day, and I can get out and I mow the grass, and I'm able to, go help my dad do his chores, and it just really helped him physically wise, more than anything. A lot of people think, well, I don't wanna get hormone replacement because it's just for sexual purposes, but it's not just for sexual purposes. It's way more than that. But for women, night sweats, hot flashes, dryness, pain, with intercourse, energy, and mood, it really takes the edge off of what some women can feel as they get postmenopausal. Sometimes we've seen weight loss. It does improve sex drive, memory and concentration, wrinkles. It just is a preventative, and it brings you back to a younger state. So it also protects your bones. So a little bit about before our clinic does hormone replacement, it's required to do some blood tests, and the blood tests for the men are different than the blood tests for the women. In women, we test the estrogens, the estradiol, and the estrone. It's not only that estrogen and progesterone are important, but having the correct ratio of your dosage is very important in preventing all that brain fog and poor memory. For men, so we do have to have, that's a mammogram, sorry, that's spelled wrong. Sorry about that. I was working on it quite a while and it was late last night and my computer was gone. But anyway, sorry about that. We do a mammogram and a pap smear for women. For men, a PSA, blood work, and a prostate exam, as long as you've had that. We do have a male doctor in our office for, the prostate exam. If that's something you wanna do with him, we're both professionals. We both do men and women. So, it's just totally up to your preference. And again, testosterone is present in both males and females. If a female feels really lousy, a little bit of testosterone is something that we add in their pellets or their cream, to help with their energy and their muscles, to help them feel more stamina. The goals for our free testosterone, which is the active testosterone in the body, for women is much lower, obviously, than men. So that blood work will be done baseline before we do any hormone replacement. Optimal hormones. Hormone replacement, like I said, is not for sexual purposes. It helps memory, healthy bones, mental health, and energy. In order for you to benefit for any hormone, the hormone needs to reach its receptor. To bind to the receptor, travel into the receptor, with the receptor into the cells, and turn on those genes that produce the proteins that coordinate with your metabolism. We do bioidentical hormones. The structures are more like the natural hormones and they don't cause cancer risk. The synthetic ones cannot really communicate with the body. The body can't recognize them, and they do pose a cancer risk. So therefore, we don't do anything synthetic in our office. Reaching optimal hormone balance, the levels are most effective and crucial, and it's part of the Recode and Dr. Brevison's book titled The End of Alzheimer's. And that's a really good book to read to understand exactly what I'm talking about. I do have a 90-year-old lady that's in my office. She gets in her car every 4 months and she does her blood work and she comes to our office for hormone replacement. She drives, she lives alone, she goes grocery shopping, she has a dog, she's very, very independent. But if she goes longer than 4 months without her hormone replacement, she gets very, very confused. Her daughter brought her in one day, and it had been about 6 months after we had done her last hormone replacement, and her daughter's like, I don't know what's going on with her. There's been a huge mental change, and what's different? And what we come to the conclusion was she had her hormones. As soon as we did her hormones, within 3 weeks, she was a different person. She was back to the same independent lady that she had always been. So she is a spitfire. So that's just one of our success stories. Sorry, my brain is fried today. Types of hormone replacement. We only prescribe the bioidenticals, as I said. The synthetic hormones are covered by insurance. However, they pose that cancer risk. The bioidenticals aren't covered by insurance. Like I said, they have the same molecular structures made by the body and produce the same effects and without the unwanted side effects. So we do hormone creams, and so with the cream, for bioidenticals, you can rub it on your skin on a daily basis. You gotta rotate your sites. The average cost at the pharmacy, you can get a prescription, take it to a compounding pharmacy, it's about $50 a month. And the pellets, we do the pellets. They're more convenient because you don't have to rub it on every day. It won't rub off on your dog or your partner or, you know, on your clothes. But they're inserted into the buttock area. We just make the smallest little incision and insert them subcutaneously. Lasting anywhere from 4 months to a year. I've had them last over a year for some people. It depends on your metabolism and how active you are and how your body metabolizes it. Along with hormone replacement, you have to look after your heart. You have to keep a healthy heart. You have to be physically active. Diet is key. Gut health is key also, and I can't stress that enough. And taking out your inflammation from food allergies. Challenging your brain every day, getting out in the environment and socializing. Just not staying in your home all the time and being dormant, social activity. One other thing I wanted to touch on is the thyroid replacement, hormone replacement. It's crucial. The thyroid controls your body temperature, it controls your metabolism, energy, so many different reflexes in the body. Most physicians might check your thyroid, but they fail to optimize your thyroid levels and your thyroid ratios, and that's very important for brain health as well. So, do you guys have any questions? Yes, ma'am.
I'm an occupational therapist and I'm also medical intuitive with a lot of stuff. And my question is, you're using a product that's not synthetic. You said it's synthetic can cause cancer.
It's a possibility, so we just,
Can you
it's
repeat
not-
your question for me?
I'm gonna give her the, microphone so we can,
I can talk loud and elaborate.
Stand up. Use the microphone, please. Stand on the chair.
Testing. There you go.
My background is I'm an occupational therapist, I'm also a medical intuitive. And I was asking, like, as far as the synthetic ones, you said possibly can cause cancer. Now, these other hormones, can I ask where are they coming from that you're, inserting, whether it's a cream or on the buttocks? What is it from?
It's, they're made from more bioidentical, we get it from, pharmacy, college pharmacy. They compound the hormones, the
Do they
bioidentical.
get it from another human or is it from an animal? I'm just curious.
So,
They're plants.
yeah, it's,
Plant-based?
it is plant-based, yes.
Okay.
And it's not from animals. The only thing that is from an animal is that thyroid hormone,
Right.
or the natural thyroid. But these bioidenticals are plant-based and,
Any side effects have you seen?
so the only side effect that I've really seen, every now and then, a woman may get their period back. For one,
Not a jury.
and that, I've only seen that 2 times, and I've done it a lot, but it only lasts for like a week. And if that does happen, we just add progesterone capsules, and it kinda cuts it off. So I am gonna be totally honest with you, I've had 2 women get like a 5-day period, and they come in, they're freaking out, like, I'm gonna die, what's going on? I'm like,
You're 90 years old, right?
I'm like, well, you know, it does bring back your youth, so, but it only lasts, if, that's a big if, and it doesn't happen all the time, I'm just being totally honest with you, from the side effects that I've seen personally, that women make it,
How old was when they start?
60s and 70s.
Did they get pregnant?
None of these
scan, you see the beginning of Alzheimer's. And then after they're on this, have you done another one and seen improvement, or maybe a slower progression of it?
I've never done any repeat scans as
Okay.
of yet.
Okay.
I go by a lot of the symptoms. I do have
That would be interesting.
yes, I do have
Thank
a
you.
55-year-old lady that, at 55, she had to retire from the police force. She worked in New York City, her and her husband were both police officers. We're doing a lot of work with her. I'm sorry, at 50 they had to retire, now she's only 55. And she was actually in my office today. Sorry. She was to the point where she could not make a conversation with you. She had accidents 5 times a day, number 1, number 2 accidents. Her husband looked at me, he's like, Greta, what am I gonna do? We're both 55. I don't wanna, I love her to death and I'm gonna do what I have to do to take care of her, but I don't wanna spend the rest of our lives cleaning up her stool and her urine, and we can't even go to dinner, much less do anything else. And I've been working on her for about 6 months. Today, he reported that he stopped counting at 8 weeks, from no more accidents, not even urine accidents. He said it's probably been a good 2 months now. She's not having, because of those, diarrhea accidents, she was getting frequent urinary tract infections. She hasn't had a urinary tract infection since. She's able to dress herself now. She's able to brush her teeth now. These things she couldn't do at 55 years old was absolutely heartbreaking for me. And her husband is absolutely amazing, taking very good care of her. And we've been working together. She's brushing her teeth now. She's dressing herself. She's putting on her shoes. She's actually having a conversation with her husband now. So we've done other work as well, just not hormone replacement. But it's a great step in the right direction for her. And I wish I would have told them to come tonight. They speak at a lot of my seminars. Her husband does. And I've had so many other stories kind of like that as well. Yes, sir.
They got the microphone.
Yes. And actually, you might have to come up here because I don't think it reaches very far.
What is the follow-up once you have the seeds implanted?
So once you have them implanted, just so everybody else can hear me. Once you have, so when you go through the blood work, we get a baseline blood work, you do the PSA, we will follow up with you, and we wanna repeat your blood work in 4 months. And that will give me a guide of what your hormone status is, and when you'll need, another insertion of the hormone pellets, if you do the pellets. And even if you're doing the creams, we like to monitor your hormones every 4 months, because we monitor the estrone in the women, which is the bad estrogen, to make sure that's not getting elevated to put you at any risk for any female cancers. And men, it's that dihydrotestosterone that causes prostate cancers. We monitor that every 4 months to make sure we're not putting you at any risk for any kind of cancers or whatnot.
Let's say you had the seeds implanted, or you took the cream, and 4 months later, there's no change at all. Does that mean that it didn't work for you, or does that mean, what does that mean?
At that point, we measure your hormones and we can increase your dose. We start out at, for men, 800 milligrams of testosterone. And then we increase your dose if that didn't work for you. If maybe you only felt a little bit of improvement, there is room that we go up in the dosage.
Okay, let's say you start off with 3 seeds in 375. So if there's no results after 4 months, you reevaluate, and then let's say you put in 5 seeds the next time. What's the cost for 5 seeds? Same price.
Because it's the same price, because basically what you're paying for, we have a sterile procedure room,
Mm-hmm.
and it's more of the sterile the
Oh.
price doesn't go up
Okay.
if we had to increase your dose a little bit.
The people, if you've used this in the past, what's the maximum amount of seeds they've had inserted at one time?
The maximum amount that I've done personally is 1,200 milligrams of testosterone.
And how many seeds is that?
That is, that's 5.
That's every 4 months.
That's like the least, I would say.
Okay.
Sometimes, some men can make it stretch out to 8 months or 9 months.
Okay.
Some men, like, they'll start feeling, you don't have like a chalkboard, do you? I kinda like to draw a picture for my patients, so I'll try to explain it. So, when I try to explain hormones, like cream versus, the pellets. The cream, I kinda explain it like the stock market, because sometimes it's gonna absorb, whether you place it here, you try to place it in very thin areas to absorb. Sometimes it rubs off, sometimes it's inconvenient, you forget it, if you're busy, you don't wanna take it on your vacation and be worried with it. So it's kinda like the stock market, but it is an option if you don't wanna go through that surgery. But it kinda absorbs, but it goes up and down, absorption wise. Sometimes it gets very saturated if you do it in the same exact spot. So then it doesn't absorb as well. The pellets, they're inserted into the buttock area, and after about a week or 2 weeks, you get up on a steady plane of absorption, and you just kind of ride out for a certain amount of time until they're absorbed, and then you'll feel you're coming down, and then you come back to us and say, hey, my symptoms are coming back, I'm feeling more tired, I'm having more brain fog, I'm having memory loss, let's talk about redoing my pellets, and that's it.
So, it sounds like it's an ongoing thing for the rest of your life.
Yes, if you don't have to do it,
Well, I didn't say that, but I mean, just based upon what you said, so like,
But-
every 4 months to a year, depends on each person.
right.
It would basically be going for as long as you're gonna be living, if you wanna maintain this.
If you wanna maintain this, yes, you're not
So-
ever gonna make that testosterone on your own ever
Right.
again, really, when you're.
My question is also would be, I forgot my train of thought.
If you remember, let me know. Anybody else have a question?
I think you answered it a couple minutes ago, but in your pellets, does that have free testosterone, or does it have like most of the drugs for testosterone, they have the boosters, like aspartic acid and a bunch of other things. Does yours have free testosterone in it, or is it the enhancers?
No, we don't have any preservatives or any fillers in our.
But it's pure testosterone?
Yes, the testosterone is testosterone. Sometimes we put the anastrozole in there. If your bad testosterone called dihydrotestosterone is elevated, we can put something called anastrozole that kind of lowers that level as well. So,
If you have a percentage from a plant, what plant has testosterone? That makes no sense to me.
I'll get back to you on that question, but
Okay. The
I
other
just know
question-
it's plant-based. I'm sorry.
The question, if you had prostate surgery and it was removed, is your testosterone, I heard, goes down because of that? Have you heard that before?
Yes.
Yeah, because I know mine's pretty low, my testosterone, because I had,
If you had a history of prostate cancer?
yeah, I had it out when I was 50. I had it removed because I had, so,
Yeah.
55, not 50, but.
And that's another thing I have to mention, if you've had prostate cancer within just the recent couple years, we try to wait to do that replacement, but if it was when you were 50, and how old are you now?
68. Oh, no, the way I like to say it right now is I just had my 50th anniversary and my 18th birthday. I like to add them together.
But as long, you're way far out.
So I could, yeah, okay,
Yeah,
because I
you're
know
definitely
mine's low,
a
I've had
candidate.
it tested.
You're definitely a candidate for.
But the doctor I had didn't recommend therapy for testosterone, so that's why I'm really confused.
We like to wait 5 years after prostate cancer
Yeah.
diagnosis and having
Right.
you cleared,
Uh,
just for liability reasons.
okay,
Um,
okay, thanks.
sorry.
This lady's had her hand up for a long
Oh,
time.
you had your hand up for a long, I'm so sorry,
Okay.
I'll get you next and. Why don't, if, that way you can get in line, if somebody has questions, they wanna get in line so I don't skip anybody, I really apologize, I don't mean to skip anybody.
I just turned 80 this year, and I'm having memory problems, and I thought maybe it was just dementia. How can you tell the difference between dementia and Alzheimer's, and what's the diagnosis? How does that is
So
determined?
there's some forms in our office, that we can have you fill out to determine exactly what type you have, depending on your symptoms. For example, Lewy bodies dementia, you'll see the patient almost looking down and shuffling their feet a lot. That's, just different signs and symptoms. You can pinpoint which one it is. We also like to do a MRI of the brain to see, is it vascular related? Are you having a lack of blood flow to the brain? And a lot of times that's from inflammation in your blood vessels. And if that's the case, I really work on food allergies and gut and the hormone replacement. Those work together very, very well we have a hyperbaric oxygen chamber that also can help push oxygen into the brain and make new blood vessels around those blockages in your brain. So that's another thing that we offer as well. Yes,
Have you considered a specialist? Do we need a referral if we're in the?
no, I am considered a family practice nurse practitioner. I have just excelled in all of these other.
But if we already have a primary, can we also?
You can do us as problem only. You do not have to, switch as your primary care. You can just fill out the paperwork. There is a packet that you have to fill out in the beginning, just, with your history. We need to know, different things about you. And after you fill out that packet, for our practice, then we'll call you and make you an appointment. And I know that she has been having her hand up.
Do you also use saliva testing as a diagnostic?
I do have saliva testing for hormones as well.
So you use the blood test and the saliva test?
Well, we do the blood test mainly for our hormone replacement, but, there is different, saliva testing that I can do for you as well. A lot of insurance doesn't cover that saliva testing, just depending on which one you're interested in, like for adrenals, fatigue, or, your estrogens and different things like that.
I've been on, I'm 72, and I've been on bioidentical hormones for 8 years.
You look great.
Thank you. And I can testify to the energy level that it's given me. Yes, there are a few side effects.
What are they?
Well, you may have a little bit more hair growth in places where you don't want it, such as on your chin. But that can be,
I have a laser for that.
that can be taken care of. That's an easy
Don't worry
thing,
about that.
but I won't go off of them until I die.
Yeah, same with my mother. I'm like, you look amazing.
Thank you.
How old did you say?
I'm 72.
72, you would never tell that she's 72. And,
I've been running for 55 years.
wow. So being physically active is a good key to it. But I would say that your hormones probably allowed you to continue to be that physically active. Am I correct?
Perhaps so. When I went to the doctor, I had lost my husband of 30 years. I hadn't taken care of myself while I was taking care of him for almost 2 years. My hair was falling out. I was about 15 pounds thinner. I was very tired. My hands and feet were freezing all the time. And a good friend of mine is the foremost hormone doctor in Germany. And he begged me to get off synthetic hormone, which my doctor here in the States had put me on. And it took a long time to research to find a good doctor who would monitor my hormones and what the bioidentical hormones were doing to my body. He also put me on thyroid medication, and I just have no problem. I'm monitored every 6 months
Yes.
with saliva and blood tests.
Yes, very good. Yes, definitely. Thank you.
Mhm.
Does anybody else have any other questions?
Is BioT a synthetic?
The BioT, as in the pellets, that's not the one that we use. I'll have to look into that specific brand. Is that what you're getting?
Yeah.
Is it, does your insurance pay for it?
No.
No, then it's probably bioidentical. Unfortunately, insurance doesn't wanna pay for anything that works. I hate to say that, but I learned that the hard way. Yes, ma'am.
Is there an initial workup that you do, or is it just blood work?
No, as for a woman, the initial workup, it has to be done in our office because we like to make sure that we're very careful. Because of liability reasons, we want to make sure that our patients are safe and we monitor them every 4 months for the hormones. The pap smear is done by me or my doctor. You can pick either one, but we just go in and make sure that there's nothing abnormal. And then we also do the breast exam for the women, make sure there's nothing abnormal growing. And then, there's a choice between a mammogram or a thermogram. The thermogram, if some ladies don't wanna get pressed and it hurts, squished, there is radiation in mammograms every single year, and there is some, studies out there that radiation is not good on the breast for every single year to get that. So we offer thermograms. It's your choice, obviously, to do whichever one you would like. The thermogram can detect any kind of hot, areas in your breast, and if there is a hot area in the breast, then we proceed with that mammogram or ultrasound or MRI of the breast, if you wanna avoid the radiation. Cause the radiation right there is not good for your thyroid either. It's definitely not, good. So did I answer your question? You're welcome. Yes.
Will insurance pay for anything?
Insurance? Yes. Yes, so that's a great question. We accept all insurances, for primary care. Your first appointment is paid by insurance. I don't know your specific co-pays or whatnot, but that obviously applies at any doctor's office, but your first appointment and your consultation, it's paid for by your insurance, if you wanna come in and talk more about it. The blood work is paid for by your insurance. So yes, the pap smear is usually covered by your insurance. The mammogram is covered by your insurance. The only thing that isn't is the actual hormones. So basically, that's the only thing out of pocket besides your copays.
What about the thermography?
Thermography, insurance doesn't pay for thermography, unfortunately.
What's the basic price?
I believe we just ran a special, it's like $100 for a thermogram. We try to make it really affordable for the patients because it's a lot better for them. Sometimes you get like a series of 3 within a certain amount of time, just as a comparison, but it's like $100 for the series, I think.
You could get just the breast or the whole body. Yeah.
That's right. I don't know if you care, Miss Jerry. Yes, Miss Jerry. I just didn't want to point you out as my little patient, but I didn't know if she cared. But Miss Jerry does come to me, and you got
I had
thermogram.
I alternate.
Yeah, so that's an option too. If you want to skip a mammogram 1 year and just do a thermogram every other year, that's an option as well. So we cater to all types of medicine. If you come to our practice and you want to establish as primary care and you choose your care, I do mainstream medicine if that's what you choose. I do alternative medicine and natural supplements, or I do a combination of both. So that's totally up to you. So.
Who's reading the thermograms?
The thermogram is read by, a radiologist outside of our office.
Outside of your, okay.
And then we get their professionally trained thermogram, radiologists that send us a report.
Okay, good.
Yeah, we don't read them ourselves.
Yeah.
I didn't go to
I
radiology school.
wasn't sure,
and-
cause I was listening and I wasn't sure whether you were.
No, I
saying
did
we're
not
looking
get
for-
trained in that, and I will not do anything to put any patient at risk for that
Yeah,
reason.
the positive to the thermograms are that they're picking things up way before the mammogram does.
Exactly.
And the mammograms, by the time they pick it up, could be too late.
Exactly. You're exactly right. Thank you,
My
sir.
sister had breast cancer, so.
Yes.
Yes, ma'am.
Do you ever offer beamer therapy to help with circulation?
I don't have a beamer in my office yet, but I kinda really like one. I have, taken
Where you could get one.
I have taken one home before, and I loved it, and, yeah.
One over there.
Yes, me
We're
and Miss,
monitoring it to make sure she doesn't take it out.
me and Miss Linda are, very close about the beamer, and, I've had a lot of success with a lot of my patients that didn't respond to antibiotics on infections that I've sent to Miss Linda, and she and I worked together closely with very little antibiotics, and her, beamer machine and the light therapy has been amazing. I have, cause antibiotics are just terrible for a person's body, and you don't wanna overload them with antibiotics, and then when we work together, it just is a really good outcome. Yes, sir.
You're doing stem cell now also?
Yes.
You and the doctor or just the doctor?
I mainly leave that to Dr. K.
What was the question, please?
He asked, it's not about the hormones, but he asked in our office, did we do any stem cells?
Oh.
You do the exosomes too?
Yes. That's our preference these days. Exosomes is the newest one. Yes.
What is the doctor's name?
Dr. K.
Dr. Crawford.
Dr. Crawford.
Crawford.
I used to see him years ago.
And, if you don't prefer him,
No, I like him.
if you like
It was
him,
insurance reasons I changed.
sometimes people like him, sometimes people don't. And I end up with all those other. Huh? Just don't, yeah, like, sometimes I get to talk people into seeing me a lot, that have seen him for years, and then they're like, okay, I wanna see you only. I'm like, deal, I can take care of you, I can do everything that he can do. I have a, license, for every, I'm sorry? We do chelation as well. I've been certified on that, I went to Philadelphia and did all of that as well. But as far as prescribing any kind of medications, whether it's controlled or whatever, I have the license to do all of that as well.
Does Village Health, do you take Village Health?
I believe we take all insurance. I have a lot of Village Health patients, I believe, yeah. I'm not sure exactly, but, I'll give you my card. We have a lot of people that come in with that, I believe. But, if you call my front desk girl, she can definitely tell you about your insurance.
And if you've had cancer, breast cancer, can you take these ones?
Breast cancer, how long ago was it? I need to see if it was an estrogen positive breast cancer or progesterone positive. HER2 negative. It just depends on the exact
Mine is HER2 positive and estrogen.
estrogen positive. I have to see the exact report on that and how long ago it was, and we run it through Dr. K in that situation, and he makes that decision on that. Just 3 years ago. We like a 5-year window on that, but, yes, sir.
I had my thyroid killed back 50 years ago when it raised with iodine. So in my case, I think in natural tea.
Yes, definitely. My sister was the same way. Radioiodine at 26 years old. I'm sorry, this, please be courteous of everybody else's questions so we can all, do you wanna come up here? His question was, he had his thyroid radiated 50 years ago, and wanted to know if he could take the thyroid hormone replacement, and yes, you can.
The natural form.
The natural form, yes. It's a natural prescription.
I
And
think Synthroid for 50 years, and I don't particularly like it now. It's bothering me.
yes,
So I was wondering, you brought it up, you know,
yes.
so I don't know whether.
You would feel, I believe you would feel a lot better. It's worth a try if you're not feeling well. No, I get it at Publix. I get the NP thyroid at Publix, and I do the GoodRx app, and it's like $30 for 90 days.
Yeah, that's cheaper than Centroid.
For 90 days, yeah. And I have good insurance, but
Is Armor a natural thyroid?
Armor is a natural thyroid, yes. Armor has a little bit more preservatives and fillers in it than NP thyroid, but Armor is one of the natural. There's like 7 ingredients to Armor thyroid versus 3 ingredients to NP thyroid.
It's difficult to get also.
But they are producing it more and more and more. I believe their facility that was in Puerto Rico when the hurricane come through wiped out a facility, but now they're back up and running, so they're producing it more. Yes. The thyroid pills, the natural thyroid. The NP and the Nature's. It's easier to get now.
Are you saying Armor is as good as the natural?
I believe NP is the best because it has the least ingredients and it has less fillers and preservatives than Armor. Yes, ma'am.
I've been on Armor for over 10 years, and it's a lot more expensive than that, because nobody will pay for it. Insurances won't put it even on the highest tier.
So I would recommend if anybody here has problems with their insurance covering any kind of prescriptions like that, download the GoodRx app. And even when patients come in and they want to switch to like NP, that is just like Armor but just less preservatives, it's called GoodRx. It's an app in a smartphone, and I print out the coupons and give them to my patient for whatever pharmacy they want to go to, and I'll tell them which one is the cheapest. And I have my nurse sit there and we'll print it out and give it to you and give you a prescription, and I try to go above and beyond for price-wise, because doing this, it can be sometimes a cost if you do the natural thyroids as well. Nature thyroid isn't as available, but NP thyroid, as an N as in Nancy and P as in Paul, NP thyroid, which I personally like. I didn't tell you about that? I'm sorry. So. Yeah, we'll talk about that, sorry. I took nature thyroid for a while, and then I switched recently, probably about 4 months ago. Anybody else have any other questions?
I'll say one thing real quick, with that GoodRx app, I just showed on my phone the coupon at Publix.
Yeah, GoodRx is amazing, but some people don't have those smartphones, and sometimes it's hard for them to get through that app thing, so I don't mind just printing it out for my patients and giving them the coupon at that time.
It gives you like 8 choices.
It gives you so many choices, yeah. It's very, because sometimes some people aren't able to do that, so I don't mind helping them out and printing out the coupon.
Thank you so
I'll hang out in the back for a little while. If anybody wants to have any private questions, I don't mind staying and answering. If you have any other questions or concerns. I have cards and information in the back.
Well, I told you about the health crisis. I told you I had first stage Alzheimer's. Obviously, I do not. And yes, I have had a brain image done, and my brain is really, really good. By the way, I've been on bioidentical for 20 years. And trust me, I couldn't be up here and say 5 words before. So this really works, and that's why you're going to continue to hear in our series more and more things you can do. I will tell you, I did use the Beamer. In 3 months, every symptom I had was gone. Every single symptom. It helps so much with circulation. And we've been laughing with Greta. My hormones are only lasting like 3 to 4 months. I have the pellet. And it's because I am absorbing not only from my food, but from supplements. and my hormones
And then you make a
so
right or
well
there you go, the cul-de-sac.
that, I'm actually
All the way
really
down.
getting way
And-
more
and-
benefit
and
from
if-
all of
and
that.
if
So it's
for
really
some
helped me
reason
health-wise. I'm also
we got a brand
72,
new
and
office
I'll
set
never
up in
go
the
off
front,
mine.
and I
I've been
worked
on it,
on
like I
that,
said,
and
for
they
20
don't get
years.
back to it
We have a
until-
table back there. One of the
Email.
things we do
On my
offer
personal
is
email,
if you're
I will
interested
make
in hearing more about the circulation,
Okay,
which affects
well, I'll get it
everything
taken care
in your
of.
body,
Just call
we
the
do
number. I'll
offer
make sure that-
5 complimentary demos.
I know, that's.
There is no obligation whatsoever, but it's fun and great just to check it out and see what it does. We have quite a few people in here that do already have a Beamer. We also have some great books back there. Take your phone, take a picture. Those are some wonderful resources for you, on some books. And, so we have lots of information. Check it out. Thank you all for coming. Just a quick, if you're not on the email list, please get that on. Dr. Koshel is gonna be back on the 28th, and you are not gonna wanna miss what he's gonna do. And our email will tell you all about it. Thank you for coming. We hope that this has been informative for you. Thank you.